fear of something in reality that poses little or no actual danger. Really?
Yes.
Do you have any phobias?
Yes, I'm an ethicophobic.
Really?
Yes, do you have one, Tiruna?
Yes, I'm a claustrophobic. Guys, do you all want to know what is ethicophobic?
And do you want to know what is claustrophobic?
Well, stay tuned to our presentation
And enjoy our presentation entitled
to know more. Good morning, ladies and gentlemen. We would like to introduce ourselves. Before that, my partner
Binita.
and me, Tiruna, are going to present on the topic phobia.
Yes.
Well, this topic is relevant for those who actually suffer from phobias.
Yes.
So, by the end of this topic, you will get to know the causes of phobia, the types of phobia, and also the ways to overcome phobias. Well, common phobias and fears include closed-in places, heights, highway driving, flying insects, snakes, and also needles.
Even needles can make a phobia happen.
Yes, most phobias develop in childhood, but they can also develop in adulthood.
Like us.
Yes. Okay, now my partner would like to continue with the introduction.
For the last few decades, scientists, psychologists, and doctors have actually made few researches and analyzed that people do suffer from different kind of phobias. Phobias are extremely complex. There is no way that 100% certainty that someone is suffering from phobia. But at the same time, phobia is rather unusual that it developed on people at the age of 30 to 35.
Yes.
Next, Tiruna will be telling you about what actually causes phobia.
Yes, what actually causes phobia? Phobias can be caused by stressful situations, certain experiences, and also frightening events. Well, a simple example of a phobia, which is the fear of blood and injury, is hemophobia. It is also known that children can develop the same phobia from their parents if they progressively are aware of this during their childhood. Well, phobias are often developed during the age of 4 to the age of 8 years old. Certain events in life are known. For instance, unpleasant experiences that often plant a seed into a person and eventually grow over time, slowly turning it into some sort of phobia. Well, example, unpleasant experiences in confined or small spaces could potentially lead to claustrophobic, which I have mentioned earlier. I actually have claustrophobic. I'm afraid of small confined spaces. I will continue with the causes. Well, some areas of our brain is actually known to store information about dangerous and even deadly events. If similar events confronted sometime in the future, our brain automatically recalls those old memories and our body reacts as if it were a recurrence. Well, phobias are irrational phenomena and sometimes possible to treat, whereby the sufferers are managing to get the brain to replace the bad and negative memories of certain events with something that is more logical and rational. Well, the areas of the brain that deal with fear often keep retrieving bad memories. Okay, now I'll give you the examples of phobia. The first one is atasagorophobia, which is the fear of being forgotten, ignored, or replaced. Next is kainotophobia, which is the fear of changes. And next will be atolophobia, which is the fear of not being good enough. And also the fear of monophobia, where you fear of being alone. Abysophobia, the fear of being fat. Atasagorophobia, the fear of being forgotten. Galatophobia, which is the fear of being made fun of. Spectrophobia, the fear of looking in the mirror. Misanthrophobia, the fear of trusting, where you know you don't want to trust anybody. I move on to the next cause of phobia, which is pessimism. What is pessimism, ladies and gentlemen? Okay, pessimism is negative thoughts that often brought by personal feelings. Well, phobia controls the person's mind. A pessimistic person is a person who has a negative thinking. Well, feeling hopeless and courageless, often demotivated, which actually gives space for fear to occur in our mind. Well, phobia remains to kill them slowly. Okay, ladies and gentlemen, I've told you about the causes of phobia. Now, my partner Vinita will tell you on the ways how to overcome phobia.
Thank you, Tirina. Moving on to the next point, which is ways to overcome phobias. We can overcome phobias by actually taking certain treatments to get rid of phobia. There are few therapies that it is proven to be effective to treat phobias. The therapies are known as cognitive behavioral therapy and exposure therapy. Under cognitive behavioral therapy, it is a type of counseling that can help you manage your problem by actually tackling your anxieties by following the first two steps. Firstly, you need to address your thoughts of what you fear of, and secondly is by combating your physical responses to the things you are afraid of. You can actually begin to repair your faulty thinking by either discussing this with your friends or by actually self-talk. The main idea is actually to reveal if you confront your biggest fear, there's no chance that will come to your harm at all. Next point is exposure theory. Exposure theory is said to be the most effective way to overcome a phobia by gradually and repeatedly exposing yourself to the fear in a safe and controlled way. You can actually feel more confident and in control. By doing this, the phobia you have will eventually lose its power. This can be done by actually following few simple steps. Firstly, is by making a list. Making a list in terms of, like I said earlier, I have an ethical-phobic. Ethical-phobic is the fear of failure during an examination. So in order for me not to have the fear of examination, I need to make a list. What I meant by making a list is having an early preparation on what I have to do to not to fear of the exam. The next way is to build your fear ladder. Building a fear ladder in terms of asking your friends, your lecturers, having a schedule, and so on. By that, you can actually make your way up the ladder. Once you make your way up the ladder, of course, you have to practice. We all know, right? Practice makes perfect.
Yes.
If we make a lot of practice, the phobia will actually reduce. It reduces gradually, but it will not reduce on the spot. Moving on to the next point, which is optimism. Optimism. Phobia occurs based on a person's mindset. If the mind is being controlled, then overcoming the phobia will be one possible way to be done easily. An optimistic person is a person with a positive thinking. They will be hopeful and be very confident about their future. They will never give in to the fear easily and will get the courage to handle it, and by finding ways and solutions to overcome their fear and phobia. The next part is conclusion. Once I have already told the ways to overcome, Tiruna and I would like to make a conclusion of our wonderful presentation.
Yes, we have come to the conclusion now. Well, phobias are actually curable and manageable. How? If it is dealt with by the appropriate psychologist.
Other than that, we can also have self-control by being optimistic. Being optimistic in terms of always having a positive thinking.
And also avoiding negativity. With this, ladies and gentlemen, you have all known the types of phobias, the causes of phobias, and the ways of treatment. We really hope that this speech has given you somewhat of information to know more about phobia.
And by this, we would like to end our presentation by thanking all of you for
spending your precious
time and lending your ears
to us.
Thank you.